So today I will introduce about diabetes. So what is diabetes? Diabetes refers to a group of diseases that affect how the body uses blood sugar glucose. So too much glucose in blood can lead to serious health problems. Chronic diabetes conditions include type 1 diabetes and type 2 diabetes. If you don't take serious about your health problem, it can be untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys and other organs. So there are a few different types of diabetes. First, type 1, type 2, type 1.5 and gestational. So, for type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin by itself. So, the most common in type 2 diabetes is usually in adults, which occur when the body becomes resistant to insulin or doesn't make enough insulin.
Every disease has their own symptoms, and I'm going to talk about diabetes symptoms. People who suffer from diabetes will have these 10 symptoms. First one is they will urinate at night a lot. The second one, they will feel very thirsty. The third one, they will lose weight without even trying. Next, they will feel extreme hunger. And the next one, they will have blurry vision. Then they will have a numb or tingling feel at their hands or feet. Next, they will feel very tired, and also they will have dry skin. They also suffer from a sore that heals slowly with the infection that are too much than usual.
Assalamualaikum. Today I'm gonna discuss about insulin replacement therapy. Before that, what is insulin? Insulin is basically a hormone that are produced by pancreas, which helps in the lower the level of sugar in our blood. Insulin replacement therapy is the primary treatment for individuals with type 1 diabetes. There are 4 characteristics for different types of insulin. The first one is rapid-acting insulin. It starts working within 15 minutes, peaks in 1 hour, and lasts for 2 to 4 hours. The second one is short-acting insulin. It takes about 30 minutes to start working, peaks in 2 to 3 hours, and lasts for 3 to 6 hours. The third one is intermediate-acting insulin. It begins working within 2 to 4 hours, peaks in 4 to 12 hours, and lasts for 12 to 18 hours. And the last one is long-acting insulin. It has a slow onset and provides a steady level of insulin for about 24 hours. Methods of insulin that are verified by administration, which are injection and insulin pump. For injection is typically given subcutaneously, which means into the fat layer under the skin using syringe, insulin pen, or insulin pump, for instance, injected at our abdomen to absorb more quickly and more predictably. While for insulin pump, it uses small devices that continuously deliver insulin throughout the day with additional for meals. It delivers insulin through a thin tube that goes under the skin. The goal of insulin replacement therapy is to keep blood glucose level as close as to normal as possible to prevent diabetes. It requires careful monitoring of blood sugar glucose level, adjusting insulin doses based on the factors like food intake and physical activities. Next, we are going to talk about pros of the therapy. There are a lot of benefits to patients with diabetes type 1. The first one is blood sugar can control. Insulin helps regulate blood sugar levels, keeping them within a target range. The second one is improve energy levels by managing blood sugar effectively. Insulin therapy can contribute to more consistent energy levels throughout the day. The third one is to prevent any complication. Properly managed insulin therapy can reduce the risk of a long-term complication with uncontrolled diabetes. The last one is enhance quality of life by helping to maintain stable blood sugar levels. Insulin therapy can contribute to an improved overall quality of life for individuals with diabetes type 1.
Every therapy has their pros and cons. For the cons of the therapy is hypoglycemia risk. So, it can causing symptoms like shakiness, confusing, and in several cases unconsciousness. For 2 is weight gain. This can be a concern especially for those already struggling with weight management. Injection site reaction is insulin injection can cause localized skin reaction, including redness or lump at injection site. 4 is cost. Diabetes medication, especially never formula and insulin analogs, can be expensive, can impacting their ability to manage the condition effects. 5 is psychological impact. Diabetes management requires significant self-discipline and can contribute to stress or anxiety. 6 is long-term complications. Despite proper management, individuals with diabetes are at risk of developing long-term complications, including cardiovascular issues, kidney problems, and nerve damage.
Next, we are going to talk about suggestions to prevent type 1 diabetes from becoming type 2 diabetes. First, we need to eat a healthy diet, especially we need to eat food that contains a lot of vegetables and avoid food that contain a lot of saturated fats like butter. The third one, we need to monitor our blood sugar for every day. The fourth one is we need to keep our body weight healthy. And the fifth one is we need to stop smoking tobacco, especially for the smoker. And the last one is we need to physically active at least for 30 minutes for each day by doing moderate exercise.